This video will discuss the process of becoming part of the UF PKT program. The PKT program at UF has 4 types of visits: the PKT interest visit, pre-initiation, initiation, and follow-up visits. A PKT interest visit is for you to discuss the possibility of going on PKT. This visit can be in person or over the phone. Factors such as eligibility and outcome possibilities can be discussed here. This is when you decide if PKT is right for you and if you would like to proceed with treatment. If you want to proceed, a blood and urine sample will be analyzed to determine if it is safe for you to go on PKT. Pre-initiation is an important introduction to PKT. This is a time where you can ask any remaining questions you may have and learn more about the program. This is located at the Medical Plaza, the Neuromedicine Hospital, or at the Clinical Research Center at the University of Florida. Initiation is when the PKT diet begins. It occurs inpatient at the UF Health Shands Children's Hospital or the Neuromedicine Hospital and lasts about 2.5 days. This is where you will obtain the skills you need to carry out the best treatment possible. Follow-up visits take place at the same location as pre-initiation. These are also combined with a neurology visit. The first follow-up will be a month after initiation, and these visits decrease in frequency as time goes on. Visits are every 3 months during the first year, every 4 months after 1 year, and, given everything is going well, every 6 months after 2 years on PKT. Let's go through each of these visits in more detail. After deciding to begin PKT, pre-initiation is the first step to starting the PKT program at UF. The first thing that we will ask you to do during pre-initiation is sign an informed consent. This informed consent gives the PKT program permission to do things that we hope will improve our understanding of how PKT works and how to improve it for others. These include administering treatment and using data for research. A full copy of the informed consent will be sent to you ahead of time. Previous medical history will be discussed so that we can accommodate any existing needs. Body measurements, or anthropometrics, and vitals will be measured. You will also be able to ask questions about PKT. There are 2 options of where this visit will occur. You can go to the CRC or the site of your neurology visit, Medical Plaza for pediatrics and Neuromedicine Hospital for adults, in conjunction with the neurology visit. If you choose the CRC visit, an 8-hour fast will be required before visits as the blood draw will take place there. If you choose the Medical Plaza or Neuromedicine Hospital, blood work will need to be completed ahead of time so that the results can be discussed at the visit. This blood work is important because it allows us to see baseline values before starting PKT. Several things must be done in order to prepare for the initiation onto PKT. Before initiation, the PKT staff is working hard to make sure everything is ready for initiation. A diet prescription is created, which will determine how much you or your child eats a day and in what ratio. We will also prescribe other things that you will need for initiation. These include a scale to measure ingredients, supplements, and multisticks, which track hydration and ketone levels. We will also send you initiation meals ahead of time with a grocery list. The grocery list has all items you will need to make meals for initiation, whether the meals are orally fed or tube fed. It is very important that when you come to initiation, you have all the food listed on the grocery list so that we can create the meals correctly. We ask you to do a few things before initiation. We want a 3-day diet recall before initiation so that we can understand what you or your child eats on a normal day. This will help us make the transition onto PKT as smooth as possible. Caloric intake will be taken into consideration so we can match what is currently eaten as closely as possible. We would also love for you to tell us any favorite foods so we can create meals that will be enjoyable. We ask that you obtain the items listed above. Finally, we ask for seizure records. These records will be a list of all seizures that occur over a set period of time. This will allow us to see what the baseline seizures are like so that we can see what progress is being made on PKT. Time to check your progress. True or false? It is important that I record a 3-day food record so that the PKT team can make PKT personalized to me. The correct answer is true. The 3-day food record helps us estimate your caloric intake and eating patterns. Initiation is when you or your child will begin the PKT diet. It takes place over the course of about 2.5 days and is done in an inpatient setting. This is so that we can be there for whatever needs you may have. The PKT staff will bring supplies needed to make meals such as a microwave, fridge, and cooking utensils. You will be taught how to make meals, administer supplements, and how to monitor ketones and hydration. This may sound overwhelming, but after initiation you will be much more confident in your abilities. We are open to suggestions for other meals and can bring a recipe book for you to look through. Also, just as at pre-initiation, we will take body measurements. There are a few things you need to remember to provide for initiation as well. The seizure records we gave you and food from the grocery list should both be brought for initiation. Materials you need to bring include your scale and multi-sticks. The most important thing that you need to bring, however, is a positive mindset and a ready-to-learn attitude. Throughout initiation, you will gain knowledge, skills, and confidence in carrying out PKT. We will provide everything we can to enable success, and we hope you come eager to learn. It's time to check your progress. Which of the visits are you required to bring brand-specific food items to? Pre-initiation, initiation, or follow-up visits? The correct answer is initiation. The biggest adjustment will be learning how to integrate PKT into everyday life. Planning meals can take practice, as it is important to know what you have on hand so that you can create the meals for the day. Making meals are also an adjustment because weighing each ingredient can take more time than preparing an average diet meal. Additionally, it is important to remember to keep daily records. As your diet changes, it is possible that side effects can be seen. A common side effect is constipation. If this happens, supplements such as Miralax can help. As with any new skill, practice makes perfect. Meal making may be challenging at first, but will soon feel routine. Record keeping is another adjustment, as you must record multiple things throughout the day. While things like meal making and record keeping may seem overwhelming at first, they will soon just become a part of everyday life. Follow-up visits are short visits where the PKT team can check up and be sure that everything is going well. We will discuss the progress that has been taking place and listen to any suggestions you may have. If it seems that the food is too much or not enough, we will adjust the diet prescription accordingly. With every follow-up visit, we will also take measurements. Just like at pre-initiation, you have two options for these visits. If you choose to be seen at Medical Plaza in conjunction with your neurology visit, blood work must be done ahead of time so that the results can be viewed at this visit. It is important for you to bring seizure and daily intake records at each follow-up visit so that we can keep track of progress. Finally, it is important for you to bring any questions you may have. We are here to help and discuss the therapy as you need. These visits are the perfect opportunity to let us know how you are feeling about PKT. If you are not located in Gainesville, these visits may be difficult for you. For this reason, we may discuss the option of telemedicine. This would allow us to do some visits over the phone or computer rather than in person. Time to check your progress. True or false? A blood work appointment can be made for 1 hour before a follow-up visit. The correct answer is false. Labs must be done more ahead of time so that the results are ready to view at the appointment. Congratulations! You have learned the basics of PKT and what it entails. If you have any questions about PKT, please contact Dr. Peggy Borum.